Amid the ongoing cold and flu season, William Osler Health System organized an informative question and answer session where they share details as to how one can take care in this cold and flu season, and one must know where they can go for care. Y Media's team members attended this Q&A session and asked the team if they have seen a spike in the flu cases this season. Let's listen into what they said.
Volume of respiratory illness we're seeing now is actually still COVID. But we've seen our numbers in RSV, which is respiratory syncytial virus, increase in the last week. We don't know if that's the beginning of a wave or not, but the numbers have increased and are in a yellow status for us as an organization. The flu numbers are also starting to increase, but they're still relatively low.
There are many people who choose not to take the flu vaccine, and we wanted to understand from the experts as to how this affects others in the community. Let's listen in.
Recognizing that there are some people in the community who can't take the vaccine for various health-related reasons, but if we assume those that are healthy and able to take them, there are some risks that occur if you don't get the flu vaccine for yourself. The flu vaccine operates by allowing those to have immunity to getting the flu, and therefore if you don't have the vaccine, there's an increased risk of the flu virus being around in the community, and then therefore a greater risk of transmission to other people. More people have the vaccine, in theory less amount of virus that would be around. There's also a risk, of course, if you haven't received the vaccine and acquire the flu, that you'll need to use the hospital more, you'll need to use your primary care more, and so that again increases the resource utilization. And finally, for those who are at risk, either from immunocompromised or have other health conditions, if they were to get the flu, they'd have an increased risk of being hospitalized. And as we mentioned in our opening remarks, just at a time where we have increased hospital usage and inpatient, it's a further strain on these.
Take all the basic precautions, stay up to date with your vaccinations, and if you are feeling sick, stay home, stay healthy.